Debbie, back to health then. And well, is everybody coughing?
Well, that's a really good question. And you know what? Before I start on coughs, I've written a couple of notes. So excuse me while I read these, because there's so much going on. I'm giving you a rest from E. coli this week. However, that story's still rumbling on. We've got Mpox rumbling on. We've got in Finland, they're going to be giving bird flu jabs to humans. We've got hospitals masking up. So there's a load of stories, but I'm going to focus this week on cough, because what is the 100-day cough? I didn't know actually that the 100-day cough is whooping cough. And as you can see, Time Out talking about the 100-day cough. And further on in the article, it actually says, have you noticed a lot more coughing and spluttering? And have you noticed that whooping cough is on the rise? So it's strange, isn't it, that it seems to be on the rise now, especially. Perhaps it's got something to do with the boosters being rolled out. I'm not sure. But if we go to another story on ITV, we can see that the NHS advice is now saying that many children are suffering. But we really do have to ask ourselves why. So I went to an academic paper and I found this: the impact of the COVID-19 pandemic on Bordetella pertussis infections. Pertussis is the other name for whooping cough. That's what causes whooping cough. And they seem to want to believe, to make us believe that this is because of a low uptake on vaccines due to the lockup. And then when all the restrictions were eased, all of a sudden, these diseases have resurged. That's what they would like you to think. But of course, we know that this is all about immunisation and vaccination. So I went to the UKHSA because it's always good to look and see what they've said. And they've updated their guidance on pertussis. They say that it's one of the most infectious diseases during the early catarrhal phase, and it remains infectious for up to 21 days following the onset of coughing. Take note on that. But let's look at the case definition for pertussis, because you can get yourself a diagnosis of whooping cough in a number of ways. So there's suspected. So you can be diagnosed if you're suspected. And paroxysms means a spasm, when you go into that horrible coughing spasm. I can't even say it actually. Post-tussive is when you cough so much you end up being sick. And then you've got that inspiration-y whoop where you kind of breathe in and whoop, you hear that noise, or you've got a 14-day cough. So if you're suspected of having any of those, you're more than likely going to be diagnosed whooping cough. Then you've got confirmed. So you can have a test, you can have a PCR test, you can have a sputum test, and that can confirm, or it can be epidemiological. So if somebody's been in contact with somebody, then also you could then be under suspicion, if you like. And they're looking at contact tracing, and family members are classified as close contacts. And they also talk about exclusion as well. And what is exclusion? Because we've heard that so many times. So they say, given the current level of pertussis activity in the population and the likely of asymptomatic, where have we heard that before? Asymptomatic infection, exclusion beyond 14 days to prevent ongoing transmission is unlikely to have a significant impact at population level in the majority of cases. It says the current epidemiological context recommendations for exclusion have been revised. Well, how have they been revised? Let's have a look and see how they've been revised. So if children are suspected or have a confirmed case of whooping cough, they need to be excluded from schools and nursery schools for 48 hours following commencement of antibiotic therapy, or if they don't have treatment, they are excluded for 14 days following the onset of a cough. But what if you can't get antibiotics? And we'll come on to that in a minute. Staff nurseries and childcare settings are exactly the same. However, for a hospitalised patient, you would have to go into respiratory isolation for 48 hours until a treatment's been completed. But what treatment? We don't know what treatment they'll be offering in hospitals. And if you choose not to have treatment or you don't need treatment, you remain in lockup for 21 days, which I thought was fairly excessive, especially if you've got an elderly person or a young person in hospital. Now, in Australia, they always say what happens in the southern hemisphere happens in the northern hemisphere. And already in Australia, we have parents going from pharmacy to pharmacy looking for antibiotics because there is an antibiotic shortage. In particular, clarithromycin and azithromycin. And it's azithromycin I actually want to concentrate on. But already in the UK, we're already seeing cases rise. They're already putting the frighteners out on everybody. And we have a shortage of clarithromycin. Now, back in 2020, Fierce Pharma put out an article because Pfizer and Teva, but Pfizer, let's focus on Pfizer. Pfizer make azithromycin. This is an antibiotic. They were in shortage of it back in 2020. It's really cheap to make antibiotics. It's really quick to make antibiotics. Pfizer are very, very good at making mRNA, upscaling a very complex gene therapy, and yet they can't seem to produce antibiotics. And in New South Wales, they've actually issued a safety notice, disruption to supply of azithromycin. And there you can see a couple of bottles. And why is all of this? What are they pushing? Well, of course, they're pushing vaccination in pregnancy. Here's a very, very short video to show you the kind of stuff they're pumping out.
Whooping cough is on the rise. Getting your vaccination during pregnancy can prevent hospitalisation. Ideally, we recommend that all women that are pregnant have the vaccine between the gestation of 16 to 32 weeks of pregnancy. If you have passed this gestation, then please don't be alarmed, you can still have the vaccine. Young babies with whooping cough can often become very unwell and need to come into hospital. Whooping cough can cause, in some cases, pneumonia and the worst case scenario, permanent brain damage. The immunity from the vaccination will pass from mum to baby. This will help protect your baby up until the baby has the first vaccinations carried out at 8 weeks old. The whooping cough vaccine is offered at your routine antenatal appointment at 16 weeks of gestation. If you're unsure where to obtain it, you can contact your GP. This can also be offered at a lot of your antenatal clinic appointments. If you are more than 16 weeks pregnant and you have not had the whooping cough vaccine, please get in touch with your GP or your community midwife to get vaccinated.
And can I just urge a word of caution? I had whooping cough as a child. My son had whooping cough as a baby. They recovered very well. I spoke to Dr. Ahmed Malik a couple of days ago. His children have just had whooping cough too. Babies are born with the most incredible immune systems. They have thymus glands that provide them with all the immunity they need. We should not be vaccinating pregnant women during pregnancy. And I would just urge caution because most of these children get better all on their own. And there are plenty of alternatives to antibiotics with regards to herbal medicine as well. So just be prepared. Don't be scared.
Debbie, thank you for that. Now,